The story of any community foundation is complex and not easy to tell. Like a coin, the Community Foundation of Grundy County has two sides, our donor services and our grants and programs designed to maintain and improve the quality of life in Grundy County. With decreasing state and federal funding for our local organizations, that quality of life is threatened. As a result, the Community Foundation's theme for 2011 is, How does Grundy County take care of its own? We have recruited some friends and partners to tell you how our work has impacted their lives.
We'd like to introduce you to Deborah, one of the families participating in the Jumpstart program at Easter Seals. We learned that Jumpstart was not being offered in Grundy County, and since 2008, we've used grant money from our Community Works endowment to bring Jumpstart services to Grundy County. Stacy Clausen, the parent educator for Jumpstart, introduced us to Deborah, and we are proud to tell her story.
Deborah, why don't you tell me about how you found out about the Jumpstart program?
Found out through Grundy County Health Department. They gave me a flyer because I was asking if there was any way that I could get any help. And so they gave it to us.
Okay. So through doing developmental screening for
Yes.
Brandon, we found out that he had some problem areas, right?
Right.
And so I referred him to Child and Family Connections.
Right.
And what types of therapies did Brandon receive?
Developmental, speech,
Occupational,
and
physical?
well, physical and nutrition.
Okay.
Yeah. Well,
Do you still visit the house, Stacy?
Yes.
What
Yes.
are the things you guys do when Stacy's at the house?
We play, we talk, we do crafts,
Do activities that
activities,
you know,
crafts.
based on his age,
Yes.
right?
Yep.
Okay, and talk about
Good.
what kind of things do we talk about things that he's doing?
His behavior.
Okay.
He's getting better with the attitude.
Yeah. How about toilet training, right?
He's getting there.
Okay, so we've talked about that.
Yeah.
What are some other things that we've talked about? Some areas that were kind of difficult, challenging as a parent?
Sleeping.
Sleeping. He had some problems sleeping in his own bed, right?
Yes.
Now, Deborah, how did Jumpstart help you? What did you learn?
I learned how to be a better mother because it was getting to me. And that's why I was looking for someone to help out. Because at the time, my fiance was like, oh, okay, you know what you're doing. No, I don't.
So when he came home from the hospital, he didn't have a manual that came along with him.
I wish. I wish. When he was a baby, there was no problem. But as he grew up, it's like, help. Yeah.
Our grant to Jumpstart is just one example of the impact we're making in Grundy County through our Community Works initiative. Our focus is not simply to increase child care or get more jobs or a better environment. We're painting a much bigger picture. We're building communities where people want to live, where entrepreneurs want to start new businesses and established companies want to relocate. We envision communities where people prosper, nature thrives, and our children enjoy lives filled with unlimited possibilities.
Our strength is the programs that we have developed in response to needs we see across the county. Sometimes there is not an ideal partner ready to take on additional projects, so we create and manage them. 941 Help is the best example of our responsive projects.
1 year ago, worked with the Community Foundation to be able to put the 941 help cards into emergency response vehicles across Grundy County. Here in Minooka, we're preparing to place them on the ambulances. So in the middle of the evening, middle of a critical incident, people are looking for some assistance. Our paramedics, our supervisors can hand out the card and get people in the right direction to get some assistance. So they'll be on our primary ambulances and also on our command vehicles, so that people are looking for things, needs that we don't really have an answer for. Giving them the 941 help card gets them in the direction of the right assistance.
We have discovered that our real talent is convening partners around issues in order to develop solutions as a team. We staff the Grundy Partnership for Children, who last year had the brilliant idea of a back-to-school fair. By bringing various partners to the table and expanding on the existing work of Operation St. Nick and We Care, Grundy County now has an event where our low-income families can go on one day to one location to get immunizations, dental screenings, vision screenings, sports physicals, and school supplies.
So many agencies working together and all this coordinated together, so many volunteers working. It's inspiring just to be a part of it.
It's amazing how many organizations are and how many people are here from all kinds of various places cooperating to pull this together. So
it's had an amazing effect. We're seeing our benevolent program is extremely active, and people are struggling, and something like this just really helps at the right time.
Had a chance to walk around?
It looks wonderful. I just saw the We Care room with all the things that came forth from people's generosity at Stuff the Bus, and I just can't get over the amount that was donated. The community has really come out in force to show their support for this, both in the donation of the items and the number of volunteers you have, and it looks like it's going to be a great day.
All right. Well, Dr. Roebuck.
It is exciting. We've already screened 100 kids.
Good.
Unfortunately, about 50% of them are needing, some classes are needing to get some checkups. And a lot of the parents don't know that there's a ton of doctors in the area that take public aid and can help them. So we're really increasing awareness, which is probably the most important thing.
This is Dr. Tim Ortiz.
Hi, Julie.
How's it going?
Good, real good. Yeah, no problem.
What are you finding with the kids?
There's some kids that are getting ready for kindergarten that need some help. They're a little bit farsighted, which means we want them to learn to be able to read clearly and efficiently, and some of them would be having problems otherwise. So, yeah, we're catching a few problems. We saw some cases of astigmatism that was undiagnosed.
Good.
So, yeah, it's working out good. Well.
All right.
Well, I mean, look, this is a tight, well-knit community where people look out for each other, and, you know, truly education is one of the things that's really most important to these children. So anything we can do to make sure they stay in school and get an education, I'm more than happy to.
All right.
I just see so much gratefulness on the people that are coming in, the children and their parents. It's very rewarding to see how happy they are and how thankful they are.
It's been incredible. It really has, Julie. It's to watch all the organization, how well everything's been planned for the first one. Really incredible. Very emotional if you go over there to the eye doctor, the dental, and the physicals. It's really been super.
So
Yes, this is a great fit. We've been working with Back to School with We Care back and forth since 1992, but nothing like this. This is incredible, especially when you see how much need there out there, or how many people laid off work, and with the economy the way it is. This has just been a godsend to see these kids getting the physicals they need, the haircuts, the dental work, the eye care. Wow, it's gone beyond anything we've ever done before.
Here because the community was so generous in giving us back to school supplies during our Stuff the Bus campaign. Woo! And we have all these school supplies to give out, and we certainly don't need them in our office, so they are here for the taking, and we want to. And the idea is that Operation St. Nick does such an amazing job of taking care of people's school supply and school clothing needs. But invariably, you know, there are always people who aren't able to get their application into Operation St. Nick in time, or for some other reason don't qualify for their services. But hey, we've been given all this stuff by the community to give out to people. We just want to make it available to people who could use it. So.
And what's your name?
My name is Randy Esbrook.
All right. And you are with
Smile, Illinois.
Okay, which is a mobile dental unit.
That's correct.
How many of these back-to-school fairs do you do?
Per week or per...
I don't know.
Sometimes we do 2 or 3 in a week. most of the time something like this on Saturdays, maybe once a month, something like that.
Good. Families and schools.
Oh, a lot of the kids are underserved, and the even Medicare and some of the insurance won't cover everything, and the kids just never have an exam to find out that they've got a problem. So it's great for the kids. If you find it early, there's a lot less work that needs to be done, and you can intercept things before they really cause a big problem on the kids. So
another group that we bring to the table as partners are the 4 different transportation providers who can often duplicate one another while still leaving gaps in the system. By calling upon the resources at Western Illinois University, we have come a long way toward creating a coordinated transit system for Grundy County.
The idea is when you have a coordinated system, there's money out there that's available. And it's not extra money that the state's granting. It's federal money that's given to the states, and it's already there. And part of it is from gas tax. So every time you fill up your car, your county is getting eligible for money. And once you go through this process, you're eligible. And we're pretty close to creating a unified system. We have united now with the Illinois Valley Sheltered Workshop, and they have some buses. They pick up their clients in the morning. They take them home in the evening, most of them anyhow. Some stay there. They have housing. And they take people different places in town that are needed. And so the idea is if they're taking their clients, they can take other people too. And in the morning when they're picking up their clients, say they have a person in Mazan that comes to Morris to work during the day with them, they can pick up other people in Mazan. And if they pick up other people, that ride is reimbursable to the state.
These projects are examples of the issues that we have chosen as a way for Grundy County to take care of its own.